The FDA is expected to approve Pfizer's coronavirus vaccine for emergency use, and that approval could come any moment now. This after an advisory panel voted to endorse the drug yesterday.
The panel concluding yesterday that the vaccine is safe and effective for emergency use for those 16 and older, even with recent concerns about allergic reactions in 2 UK healthcare workers. Once the FDA gives final approval, Rhode Island says doses could be here within days.
This as the COVID picture here in the state remains bleak. Rhode Island's death toll has now topped 1,500 with 11 new deaths reported today. More than 1,200 new cases were reported and 466 COVID patients are in the hospital.
As the country waits for an update from the FDA, Rhode Island is busy getting ready to receive the vaccine. Doctors at Rhode Island Hospital tweeting out they've already been scheduled to get the vaccine. Frontline workers and first responders are set to be the first to get it. 12 News reporter Brandon Truitt is live in Providence. And Brandon, you're learning more about how the vaccines will be brought in.
Well, Kim, the state says that the first doses are going to be brought in on FedEx and UPS trucks. First stop are hospitals, and tonight the state says that they are ready to receive them.
We're simply waiting to get the vaccine, and when we do, we'll be ready to start.
It's go time. The Rhode Island Department of Health says they have been planning for this moment for months.
We have all of our supply lines and chains and logistics ready to go.
The state giving new details on how vaccines will be delivered. Much like your latest online shopping order, FedEx and UPS will be carrying the precious cargo, but in special containers.
We're focusing on everything.
Dr. Carrie LaPlante of URI's College of Pharmacy serves on the state's vaccine advisory committee, saying they have been planning for all of it.
We're focusing on safety, efficacy results as they come about. We are talking about prioritizing distribution from phase 1A to phase 1B.
The Department of Health says they'll get 10,000 initial doses from Pfizer, that same amount a week later. The state is not administering the vaccine, nor are they storing it in their facilities. It's going straight to the hospitals and pharmacies, giving it out.
You know, it hasn't skipped any steps.
Now doctors are working to build the public's trust, saying a vaccine is only as effective as the number of people who get it.
I am at a hospital practice site, and when offered to me, I will receive it. I feel I have a sense of duty to do it, and I trust in the safety. I trust in the process.
So the state is still working to iron out the details of delivery for the later phases. As it stands right now, the state says when multiple vaccines are ready, which one you get will simply depend on availability. Live in Providence, Brandon Truitt, 12 News.
Also tonight, the FDA is working on approving Pfizer's COVID-19 vaccine for emergency use. The AP reports the White House is pushing the FDA chief to approve it by the end of the day today.
And we've learned some Rhode Island healthcare workers are already being scheduled for their shots. 12 News reporter Brandon Truitt continues our local coverage. Brandon?
Well, Kim, some of those doctors here at Rhode Island Hospital, one of them put it this way: it's the happiest that he's ever been hitting the send button, meaning to schedule his vaccine. The state says when they're ready and when they come in, they're going to be headed to the hospitals first.
I'm excited. I'm very excited.
In the world of public health, this is as big as it gets.
We're focusing on everything.
Dr. Carrie LaPlante with URI's College of Pharmacy also serves on the state's vaccine advisory committee. She says they have been planning for this moment since October. The vaccine not skipping any steps.
This vaccine has gone through the traditional phase 3 clinical trials. It's going through the same federal regulatory authorities for final review of safety data. They have the independent group investigating and monitoring all activity, all side effects.
All that to say it's being vetted before it gets to you.
We have all of our supply lines and chains and logistics ready to go.
The Department of Health says vaccines will roll in on FedEx and UPS trucks, taken straight to hospitals throughout the state. Doctors at Rhode Island Hospital gleefully tweeting their appointments have already been made. I cannot wait to be protected from this horrible virus, reads one. But in the meantime, mask up, please.
We're simply waiting to get the vaccine, and when we do, we'll be ready to start.
The state says hospitals already have the equipment to keep the vaccine at the necessary 94 degrees below zero. Pharmacies are working to get it too. Tonight, a sense of relief is not a matter of if, but when, with doctors feeling duty-bound to receive it.
I'm happy to be the first one to receive this vaccine as a healthcare professional.
So hospitals are going to be administering it to their own staffs. Pharmacies will be taking those doses to long-term care facilities, administering it on site. The state says that will get them through phase 1. Live in Providence, Brandon Truitt, 12 News.